Kia ora koutou, David Matthews from CCS Disability Action. Currently there are a number of demonstrations occurring in the sector which are aiming at providing more choice and control in disabled people's lives. These include a range of demonstrations from individualised funding through to choice and community living and through to enabling good lives. I'm interested in what each party's opinion is about those particular demonstrations, and particularly the role of community organisations in the future of these particular demonstrations.
We want to make sure that, that we promote the full participation of disabled people in creating an inclusive Aotearoa. There's been some great work done to date, and we want to increase that by ensuring that we build the capacity of research for people with disabilities to participate in that, and that we enforce accessibility standards in the provision of transport, housing, built environment, information and technology. Oh gosh, okay, like in the community, look, we just need to make sure that there is a fair payment for support workers, including NGO staff, making NGO staff rates comparable to THB, and also monitor the ability to monitor the quality and performance of health services. We need to keep that up and do it better. Increase community-based rehabilitation services. There is some really good work happening out there, but we just need to make sure that disabled people are determining the priorities of what gets done in the community for their community. Kia ora.
Thank you. At the very high level, I'd refer again to the Disability Action Plan, which emphasises as one of the 5 values safety and autonomy. So people actually having an ability to make those decisions, and also self-determinations, so that people can make decisions based on their own aspirations and have access to information to support those decisions. But in terms of one particular area, which is housing, I'd like to point out that this is something we have backed, further community level involvement rather than everything being run centrally by government. We've supported this by boosting the social housing fund for high needs families by an extra 30 million, so that greater autonomy and greater self-determination can be employed, and groups can deliver on a whānau ora style model, something that's relevant and centred and appropriate to that community.
And David, can I just make sure that you're just asking about the relationship that governments have with the existing organisations such as yourself to keep working in partnership? Is that essentially what you're after? Is that the question? Okay. Gosh, I've used up 30 seconds already. Okay. Well, all I can tell you is that we're committed to make sure that we work with organisations such as yourself to be able to deliver some of the policy outcomes that I've spoken about earlier. Gosh, you're very good at this. And also, to the second half of your question, David, I couldn't quite hear that. Okay, well, I'm sorry, I don't have enough information about that to answer that in a meaningful way, so I apologise for that, but I'll come and see you afterwards and make sure I get what I would call a decent answer from Ruth.
I think it's really great that you're looking at different alternatives and demonstrations and things like that, and in terms of self-determination, New Zealand First would be very interested in what the outcomes are, and we'd certainly be prepared to support them. It's a great idea to do that. My background is as a scientist, and really the idea of looking for alternatives is always important, very important. Thank you.
I don't understand it. You've asked about individualised funding, support for service organisations and support for community organisations. Okay, with individualised funding, we recognise that it works very well for some people, but we also recognise that it doesn't work for everyone. It is not because the person at the centre of individualised funding effectively becomes the employer, and that is not always able to step up and manage that. So for some people, what we want to see is that there's a real choice, that there's sufficient funding and support given for service organisations, for the people that want to access these services, and also make individualised funding for the people that can make individualised funding work for them.
Thank you, Mojo.